Years ago, when you would hear the term hospice or hospice care, well, it might be something that might scare you. But believe me, the hospice of today is definitely not the hospice of yesterday. And that's exactly what we're talking about today with our coastal expert. Joining me now is Dr. Julia Johnson, Chief Clinical Officer with Hospice Savannah. Hi, Dr. Johnson. It's great to see you.
Thank you so much for having me.
So let's start right off by talking about hospice because, as I said, it's definitely different today. What is hospice care and why are people so reluctant to access it?
Good. Hospice care is a program that helps support quality of life and comfort for patients who are dealing with a life-limiting illness or a serious illness. It's a program that uses a team approach. Often doctors, nurses, nurse practitioners, chaplains, social workers, volunteers, and in our case, music therapists, massage therapists, bereavement counselors, all in an effort to provide comfort and quality of life for patients who are going through a difficult time in order to support the patients and their families.
So, Dr. Johnson, let me ask you this. What is the biggest misconception people have about hospice care?
I think that people hear the word hospice and they immediately become afraid because we're talking about death and dying. And I think that brings up a lot of emotions, that brings up a lot of fear. But hospice care is not about death and dying. Hospice care is really about living. And it's about bringing as much quality of life for people and their family as much as we can. And that's different for different people.
Because there's so many different services connected with, like Hospice Savannah. What do you wish people could know about hospice care?
I think you really have to look at quality of life because that's different for different people. For one person, it might be having their pain and symptoms managed so that they can go fishing. For somebody else, that might mean having a volunteer come to the home so that your husband can go to the grocery store, run some errands, go to a church service. For another person, it might mean getting the equipment in the home so that you can go to your grandson's graduation. Quality of life is different for every person and every patient and every family. And so whatever hospice programs can do to support families is what we're all about.
You know, there are 16, 17 hospices in our community. Why should people choose Hospice Savannah? I mean, you guys are our experts and you do a phenomenal job providing so many different services. Why should people choose Hospice Savannah?
You're right. There are many hospices in Savannah. And there are several things that I think put Hospice Savannah apart. The first is that we're the oldest and largest hospice in Savannah. We've been here for almost 40 years. We were founded in 1979, if you can believe that.
Wow, that's a long time.
Yeah, started as an entirely volunteer organization, volunteer doctors, volunteer nurses, and it's grown over the 40 years to become this very strong resource to the community. We cover 5 counties, so we see patients in Chatham, Effingham, Bryan County, Long County, and Liberty County, so our reach is wide. And I would bet that there are viewers watching now who have been touched by our services, who have had loved ones under our care in all of those counties right now. We also have Hospice House, which is our inpatient home-like environment. Most patients want to be at home and their families want their loved ones to be at home with them during the end of life time. But sometimes symptoms can become very difficult to manage. And so having our Hospice House on Eisenhower, which many of your viewers are probably familiar with, can be a very valuable resource for those patients who have symptoms that are difficult to manage at home, and that can be very stressful for families. So that's a really wonderful resource that we can offer to the community.
So not all hospice care facilities are built the same, so it really does make a difference which one you choose. And of course, you've been doing this for quite some time. Can you talk about some of the success stories? I mean, maybe a few of your patients and families that have been helped by Hospice Savannah.
They're countless, Natalie, they really are. I guarantee you there are viewers watching now who have had a loved one under our care or who have a loved one under our care right now. And I wish I could have a patient with me now to really tell you what a difference it makes in their lives. And the one thing that I hear from patients and their families so often is, I wish I had called you sooner.
So, Dr. Johnson, when is the right time to get a hospice consultation, and how does one go about doing that?
That's a great question, and it's very difficult to know. Insurance companies tell us that hospice programs are available for patients who are approaching the end of their life, who have a life expectancy of about 6 months. But I would bet that you have viewers right now who are asking themselves, is now the right time for my dad? Or is now the right time for my wife? Are we looking at 6 months or less? And there's a lot that goes into that determination. The number one thing I would tell patients to do is to ask their doctor. Sit down with their doctor and say, is now the time for hospice? Are we approaching that time? And then secondly would be to call us at Hospice Savannah. We're available 24 hours a day to answer the phone, and we can schedule a visit with a nurse to come to you, whether that's at home or a nursing home or in a hospital, to do an assessment to see if now really is the time. And in coordination with your physician and with one of our full-time board-certified hospice physicians, we can make a determination if now's the time.
What would you like to say to our viewers out there so that they do educate themselves to know that this service is available to them?
I would like viewers to know that it's about living, that we're here to support you. We have a team of experts that are trained exclusively in end-of-life care to be able to support you and your family and really provide the resources that are so important to you in this very difficult time.
And we're very lucky to have Hospice Savannah right here in our area. Dr. Johnson, I want to say thank you for all the wonderful work that you guys do at Hospice Savannah, and I'm so glad that you're our coastal expert.
Thank you so much for having me.
Great to see you. If you'd like more information on Hospice Savannah or any of our coastal experts, just go to our Coastal Experts page. You'll find that at WSAV.com.